Me.
Don't.
Uh,
All right, it looks like it's preparing.
we do. We on the at the monastery, we probably only have 5 or 6 people watching on YouTube. But then if you go back and you look at YouTube because it stays on YouTube, some of them have like 100 views. People
Yeah.
come back and look at it.
All right, hello, YouTube. I think we are live.
Hello.
How are you? If anyone is out there, and we'll go ahead and go live on Instagram. Live. Oh, the sun's coming out. That's nice. Okay. So I am live on Instagram. Hello, happy Friday. Come on in. And we'll wait for Dr. Q to send a request, or I'll wait for you
Yeah, I'm
to.
looking at Instagram. I don't see the live on Instagram.
Uh, you can refresh your feed.
Oh, yeah. There we go. I don't know why I never do that.
They're changing it all the time. Hello. Hi, everyone. How are you? Thanks for joining us this live. Hi, Travel with Crystal. Where are you all tuning in from? Share where you're tuning in from, and
I,
we
s-
will get
I sent you a
started.
request on Instagram.
Okay. Got Dr. Q on in a second. I hope you guys got some good questions today. We got Texas in the house. We got California. Dr. Q and
Yeah.
I are in California. I live in Florida, but currently in Philly.
Oh.
Nice. Hi, Ingbird. All right, who has our first question? If not, I'm gonna override you all and go ahead and grab a question that was sent in. Hi, you're from Nigeria. I see South Africa. Okay, we got our very first question. Thank you, Aaliyah. So it says, my sister is due to give birth in December and has sickle cell. What are the main precautions to help her get through postpartum?
Well, I think if I don't know where you're calling in from, but most people who uh, have a pregnancy, they have a specialist for OBGYN, and they also have they're in a hospital that specializes in taking care of newborns. In the postpartum period, um, I think that after giving birth, women who have sickle cell disease may have a little more pain than other people, except it's so painful. It's hard for someone who doesn't have sickle cell disease to think it's a piece of cake. But I think Cassandra knows about what happens after you have your baby if you have sickle cell disease.
Yeah, I mean, so nothing noteworthy to me. When I had my daughter, this was back in what, 2014. I don't feel like postpartum was a big conversation. So that wasn't anything that I ever looked out for myself. I didn't notice. I just feel like weird stuff always happens to me anyways. So it was just like, I'm just going through the emotions or going through the flow of whatever this is, right? And there wasn't a name put to anything. I don't know if I experienced postpartum depression or anything, but um, postpartum is just getting really back into the swing of things and, finding a new regular. I I don't think I experienced any more pain than I did before. And I had a really good pregnancy. So I don't know that I had any like large change postpartum other than being a new mom. And that in itself is very, very tiring and fatigue and all of that. So you have to have a really good partner, a really good support team. I did stay with my mom for probably about a month. I stayed at my mom's or my parents' house for about a month, and then we um, eased our way back into or eased our way into our place. And yeah, so I'd say mostly a support system, making sure that and you're such a nice sister for asking that, but just being her support because I don't know if a lot of us know what's going to happen, postpartum. Hopefully that answers or, that's just my 2 cents. All right, I see Nevada, I see South Africa. Um, and this person says she does have a specialist in healthcare is better up there for her. Oh, perfect. Yeah, as long as she's being seen by, I got seen by a perinatologist and I got seen by a GYN, and then I got seen by my hematologist, and then I got seen by my primary care. So I had a whole team behind me as a production. All right, I see somebody said, I don't know if this is a question. It says risk of thrombosis is greatly increased. Is the risk of thrombosis increased with sickle cell?
People with sickle cell disease uh, do have more inflammation, and there is a probably, I haven't read this, but probably there is a slight increased risk of thrombosis. But even people without sickle cell disease during birth and sometimes during pregnancy can have uh, pulmonary emboli. Even some very famous people uh, had uh, had pulmonary emboli after their birth. So it is an issue, but probably pretty rare. And if you, I mean, usually emboli are pretty obvious if you have pain and uh, decreased circulation in a limb. Chest pain after birth would be um, indicative of a possible pulmonary embolus, which is really serious.
All right, we have a new person new to the page. They say new to the page and wanted to ask about those with sickle cell trait. Do they have symptoms, episodes as well? If so, what does that look like?
So people with sickle cell trait, generally speaking, are are relatively well. They do have, since we're speaking about thrombosis, they do have a slightly increased risk of thrombosis in surgery, um, post-operatively. Uh, but again, it's not super common, but it's something that a surgeon and the internist taking care of a person with sickle cell trait would have to think about. The biggest, most common thing you hear about is having with really extreme exercise and dehydration, having hyperhemolysis and problems with kidney failure, that has led to death in some people. But these are, generally speaking, they're really athletes who are pushing themselves kind of to the limit. People with sickle cell trait who go to high altitudes, like if you're climbing in California, the Sierras, you can end up having splenic infarcts if you have sickle cell trait. Um, so there are some problems with sickle cell trait. Um, but but most people who have sickle cell trait don't really have any symptoms. So, for instance, when I was practicing, most of the parents who had a child with sickle cell disease, meaning both parents had sickle cell trait, it was extremely common for neither of the parents to know that they had trait until they had a baby with sickle cell. And they were, they were very surprised that they could have a baby with sickle cell disease. Everybody now in the United States is screened, but the notification if your child has sickle cell trait is kind of like your child doesn't have sickle cell disease, has sickle cell trait, which is not a disease. So a lot of people, parents, sort of go, "Oh, great, my kid is fine," and then they never tell their teenager, hey, you have sickle cell trait. So many people with sickle cell trait do not know they have sickle cell trait.
I do. There's some, patterns that I've noticed from people with sickle cell trait, and you guys just take this with a grain of salt. Like, just take it with a grain of salt. But I have noticed you all sleep a lot. I noticed you guys like to nap, and I noticed that you guys are really good at drinking water. Like everyone with sickle cell trait that I know, they always carry around a bottle of water with them. And that's good because you have to stay hydrated even when you have sickle cell trait, and there are there are more rare complications that are, bigger or more life-threatening complications that are also associated with trait, but they're, like I said, they're very rare. But kidney health I think is big within sickle cell trait, and staying hydrated helps you know, helps with that. So that's my 2 cents on sickle cell trait. The next question I have is I have sickle cell suffering from a ulcer of the eye. It has been months now going for clinic and nothing has been done. I'm getting tired of the pain. Have you heard of ulcer within in
Well,
the
you can
eye?
have, I don't know where the ulcer is, but you can have ulcers on your cornea, um, sometimes caused, by viral infections, which are pretty painful. I'm not sure that that is a sickle cell, it's not limited to
Related
sickle
thing.
cell, but it's very painful. And my recommendation would be to see an ophthalmologist who at least could take a look at your eye and give you some kind of eye drops that would decrease the pain. I wouldn't like go to the pharmacy and just randomly buy eye drops to put in there. I would make go to an ophthalmologist and make sure that you're getting what you need. So some eye drops might have steroids, which under a physician's guidance might be okay, but generally speaking, you don't want to put steroids on a infection.
All right. Somebody is asking about medical records, but I'm not sure what the question is. Somebody said, do you review medical records? If you do not review records, can you recommend someone? Okay. When I just read it, it
Yeah.
all makes sense now.
No, we don't review your medical records, but I think that, you could, if you have you need someone who has a medical background for sure, and somebody who knows something about sickle cell disease. So you could, wherever you live, you could look to see if there are any internists or hematologists in your area who would be willing to do that. Um, it's only you can release your medical records to somebody or get copies for yourself. So you'd have to be involved in that. There are issues with um, reviewing records, but if you have some complaint against a hospital or a doctor or whatever, you almost need some legal person to guide you through that because most doctors don't want to review records and then end up in court. So that's also an issue.
Okay. If someone has 0 to 2 hospitalized or hospitalizations per year, pneumonia related, do you recommend them doing the treatment for sickle cell? And is there an age limit on getting this treatment? And I'm assuming that treatment is hydroxyurea.
Right. So every if you've ever watched this before, you know that I'm really a big fan of hydroxyurea. So just this year, around this time, there are several articles about review articles of hydroxyurea because hydroxyurea has been available to treat sickle cell now for 30 years. That's kind of a long time. And so some of the issues with hydroxyurea that people worried about, like it's chemotherapy. So does it promote cancer? Do people with sickle with who take hydroxyurea have increased risk? And over 30 years, the answer is no. There doesn't not seem to be an increased risk with that. Hydroxyurea is really right now, actually one of the few drugs that you can take for sickle cell disease. And it is very effective if you have a hematologist or who's monitoring you because you have to increase the dose until you get to a place where your fetal hemoglobin has increased. Some people call that the maximum tolerated dose, which is when some people advocate, experts in hematology and in hydroxyurea, they advocate increasing the dose of hydroxyurea until you see a slight decrease in the white blood cell count, which means, which happens, which is not bad for people with sickle cell disease because their white cell count is generally elevated. But they continue increasing that dose until the white cell count shows some decrease, which usually corresponds to the highest level of fetal hemoglobin that you're going to be able to um, produce with your with hydroxyurea. Fetal hemoglobin is the hemoglobin that you had when you were in utero and for months later, and it inhibits sickling. That's why really small infants don't have any um, symptoms of sickle cell disease because their fetal hemoglobin is so high. Um, and so hydroxyurea is very effective in treating sickle cell disease if you have a physician who knows how to use it, and it requires some lab work to follow this, but it is very effective to get your fetal hemoglobin up. And it turns out that hydroxyurea actually inhibits the system, the chromosomal system in your body um, that it regulates fetal hemoglobin. So it downregulates that, which increases your fetal hemoglobin. People have frequently wondered why fetal hemoglobin increases with hydroxyurea, and that could be the reason. That was recently reported. But it needs to be monitored by someone who knows what they're doing with hydroxyurea. And if it is, then it's very effective in decreasing pain and other complications of sickle cell disease by itself.
Somebody said I used hydroxyurea and had hair loss, and my doctor nor myself seemed to know if it was working for me or not.
Well, I think so that the things that you can look at, well, if you have access, the things you can look at is your fetal hemoglobin should go up. So whoever's prescribing fetal hydroxyurea should be looking at your fetal hemoglobin. You should do, they usually take a blood, do that blood count and evaluation before you start so they know what the baseline is. Then they can see how far your fetal hemoglobin went up. The other thing they need to look at is the size of your red blood cells. So when you're taking hydroxyurea, your red blood cells should actually get a little bit bigger. And your white count should go down. If your white count's not going down and you don't have slightly larger red cells, then the dose is probably not high enough. As you get to the I hate the term, but the maximum tolerated dose or the most effective dose, you should see some decrease in your white count. If you don't see a decrease in your white blood cell count, then you could probably increase that dose and have more effect. But unless you know what your fetal hemoglobin is and your labs, you can't really know whether or not you're on a dose that would be effective. And your fetal hemoglobin should go up as well. So there's a lot of nuances in taking hydroxyurea, but most people who take care of, most doctors who take care of people with sickle cell disease should know how to monitor that and how to change your dose to make it the most effective dose for you. And it's different for everybody. The other thing is, it doesn't work. It's not like taking aspirin and your headache goes away in a couple hours. It takes sometimes months for the hydroxyurea to actually reach your fetal hemoglobin reach the highest level it's going to reach. So it doesn't, it takes time for it to happen. And hair loss, depending on, I've personally never seen anybody who has had hair loss that I could notice who took hydroxyurea. I'm sure other doctors maybe have. Um, but that's not that's kind of a trade-off for not having as many problems with sickle cell disease and having the organ protection of high fetal hemoglobin.
There's another follow-up question since we're on the topic of hydroxyurea. This person said, I am 25 now and have never taken hydroxyurea before. And I'm guessing pain is not that much. I only take pain relief and sleep, then I'm fine. I don't know if I should start taking it.
Well, I think I think everybody who has sickle cell disease should consider taking hydroxyurea. Um, even though you don't feel like you're having any problems with your sickle cell disease, you could be having kidney problems, you could be having other sort of problems that don't show up until you get to be much older. The other thing is if you're 25 and you haven't, and you're not being followed by a hematologist, you have to wonder, um, what type of sickle cell disease do you have? And you might have S beta plus thalassemia, which is it's a less severe form of sickle cell disease. Um, but hydroxyurea should be used by people who have sickle cell disease uh, when they have S beta 0, or probably S plus. People with SC disease, it has been shown that people with SC disease do have improvement when they're on hydroxyurea, but not it. I don't think it's for people with SC who have more severe disease. And there's a lot of things about sickle cell disease that we don't understand. For instance, siblings, we talk about this all the time, but siblings with the same parents, same SS disease, but does not present the same in siblings frequently. And so there are other things that you inherit that affect the way sickle cell manifests itself in for you personally. So um, I think that anyone who has SS should be on hydroxyurea, even if they don't have a lot of symptoms. But that's something you need to talk to your doctor about, if, especially if you don't have symptoms. You have the right diagnosis, what is your diagnosis, that kind of stuff.
Yeah, I never like been sick in a major way. I get like big sick, and that's when like I'm either traveling or, and the last time that happened was 2017 is when I was hospitalized. And so um I do deal with chronic pain now as an adult, but outside of that, I don't really have symptoms, but I take hydroxyurea because I take it for organ protection. I want to make sure that it slows down the damage that sickle cell does on my body. And I really take it out of self-preservation. I just think I don't take it for pain. I never took it to get my hemoglobin increase. I never took it to necessarily be in less pain. I took it to preserve my organs better for sickle cell. And so um, Dr. Ware, and he was on live earlier this year. He gave a talk, and he said something to the effect that hydroxyurea decreases mortality rates in sickle cell. So that's all I really needed to hear. Like, hey, live longer with sickle cell. Yeah, sign me up, right? And so, but it was a bunch of conversations, and it was a bunch of understanding um how hydroxyurea works for sickle cell, and like really just understanding it to make the informed decision. So for me, I was like, weighing benefits versus risk, hydroxyurea. I want to be around for my daughter. I want to be around for my family. So this was why I started taking it, and not because of pain, not because of symptoms. So that's hopefully that helps when I share that with people. A lot of people try and think about sickle cell. People only think they're doing bad when they're in pain, but a lot of people don't know that sickle cell is a progressive disorder, and there's silent damage happening. Even if you're not in pain, your body's still sickling. So that damage is still happening, even if you're not in pain. And a lot of people don't know that. And so once I learned that, sickle cell is still sickle selling, even when I'm not in pain, even when I'm good. Um, that's really what helped me decide to start taking hydroxyurea. But the choice is ultimately yours. Just make sure you have all the facts, and make sure, you really feel that you've gotten an understanding and really have a um, comprehensive view of what it means to take hydroxyurea. It also means you have to have a sickle cell doctor. Somebody said earlier that their doctor didn't know if the hydroxyurea is working. It sounds like that's not the right doctor to be prescribing you hydroxyurea, because you have to kind of be an expert and know what markers to look for in order to prescribe hydroxyurea. So either that doctor, I'm not sure. I'm not sure why they wouldn't be able to know if the hydroxyurea is working. So that just makes me think maybe that's not the right doctor for you to follow your care, or to follow your sickle cell care and tracks hydroxyurea. So that's my 2 cents on hydroxyurea, and hopefully that's helpful. Yeah, I've been taking it for probably a close to a decade now, maybe more. I don't ever remember when I started taking it. I should have started taking it earlier when Dr. Q was telling me to take it earlier, but I had my own journey, and I can't I have this thing where people can't tell me what to do, or no, 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 I'm just fine. But yeah, I don't know. I had to kind of find out for myself, unfortunately. But do as I say, not as I do.
Yeah, hydroxyurea does not work for every single person. So
Yeah.
um, there are people for whatever reason hydroxyurea doesn't seem to work, and it's not clear why that is, generally speaking. Um, but it it's been around for a long time now, and there's a lot of studies that show that in if you have a doctor who knows about hydroxyurea and how to monitor hydroxyurea and how to change the dose depending on what your laboratory work shows, then it's very beneficial. And the person that Cassandra's talked, Russell Ware, is the one of the leading experts in hydroxyurea. So he knows what he's doing.
Okay. Let's go ahead and move on, and we can return to this conversation. You guys have more questions on hydroxy. Question regarding to older STD patients. I will soon turn 65. Yay,
Hey.
congratulations. What are some baseline things that should be done for everybody or done should be done for everyday good health when you're aging with sickle cell?
Well, I think, the things that if you're 65, you've been, whatever
You
you've been
you
doing
gotta
is
figure it out. No.
fine. Keep doing whatever you've been doing. But, I think you have to, as you get older, the the wear and tear on your organs is even for people without sickle cell disease. You have to take care of yourself. So, people with sickle cell disease who are older should have their renal status monitored because the kidneys are very acidic. They have kind of a low oxygen level. So, your kidneys take a hit if you have sickle cell disease over a long period of time. You should monitor your lung function, make sure that's okay. You should also have your eyes looked at if you've to make sure that you don't have any sickle cell related eye problems. Um, I think, you could talk about your joints like AVN and stuff like that, but those things are pretty obvious because you have hip pain, and if you have anything like hip pain, shoulder pain, those kinds of things, don't write them off. You should have it checked out to make sure that you're not developing anything. The other thing you need is you're 65. So you need to have all the things done that people who don't have sickle cell done. So you need to make sure you're immunized. With our new administration, they're not big on immunization, but you should have like your COVID vaccine. You should get your flu vaccine, stuff like that, because um, if if you were to get sick with one of those two infections, you would probably end up in the hospital. I mean, I would probably end up in the hospital. I'm kind of on the older side, so I get all my vaccines. I don't particularly want to end up in the hospital, which I might if I got COVID. But I think, besides your sickle cell, you have to look at just the things that happen as you get older, generally.
All right. Next question I have, I see somebody reposted any info on the effects of steroids on sickle cell patients? I think prednisone has launched a crisis. The last two times I took it, even with the taper, does prednisone impact sickle cell? And I'll just say, right off the bat, I don't know, but the same thing happened to my sister with sickle cell too, where prednisone would put her in crisis. So I don't know if there's a correlation there officially, but you're not alone in experiencing that.
Yeah, steroids are really big anti-inflammatory medications, and they have a lot of side effects. And so there's some reason that you're on steroids. And so, you have to kind of address that. That's a separate issue. But whenever you stop steroids, even with the taper, the inflammatory system that's been suppressed starts becoming worse. And that's why you can't just stop steroids cold and not experience some kind of side effects. If you still are, the only thing that you might, if I mean, there must be a reason you're taking steroids. So what you'd have to have is a longer taper. Instead of tapering, say, in 2 weeks, maybe you should taper in 3 weeks or something like that. Um, but it's something you need to talk to your physician about to figure out what your dose is and how your taper is going. And you might expect, even with a longer taper, that there would be some effect when you completely were off of steroids.
So it's steroids, they're major anti-inflammatories, which kind of sets off your body in a way.
Yeah, I mean, it's like once you're off steroids, everything that was going on before you took the steroids, you know, happens again. And so, and you're not used to it. There are other effects of steroids, but what you feel is the change in the inflammatory problem. Or if you're taking them for another problem, like some other disease that responds to steroids, that may um, start causing problems once you taper off your steroids. It depends on what you're taking them for.
Okay. I was recently told that I am overhydrating myself. How do I find a balance? Also, I'm a pescatarian, yet my iron is still low. How do we find a balance? Can we take B12 and B6? I've never heard of somebody overhydrating,
No, neither have
like
I.
drinking too much water.
Um, Not with sickle cell disease for sure, because if you have sickle cell disease, your kidneys don't concentrate your urine as well, so you're you're basically keeping yourself by drinking a lot, you're keeping yourself hydrated. And you can expect, just like me, if I drink a lot, I have to urinate more. But if you have sickle cell disease, you might urinate a lot, but that just means you're well hydrated. Um, you so it would be unusual for someone to become overhydrated just by drinking. Um, and for iron, you have to make sure that I assume that somebody has told you you have iron deficiency and they've done some kind of laboratory work to make sure that you have people with sickle cell disease can be anemic, but that doesn't mean they have iron deficiency, although they can. And so you have to be tested to be sure that you really have iron deficiency and not like B12 or some other kind of deficiency. Um, and then in that case, you can take iron just like anyone else who has iron deficiency. And there are different formulations for taking iron. Again, then you have to be monitored because at some point you may not need the iron anymore, and you all should also should be worked up to figure out why do you have iron deficiency if you're older, and is it your diet or some other reason?
Is her diet, she's a, or this
She eats
person,
fish a lot, but
yeah.
fish have iron. Your diet basically, if you're on a regular diet, even if you're a vegetarian, unless you're a vegan, you probably shouldn't have it. You're a little more at risk for iron deficiency, but um, it would it would be it's not something you'd think about right away. But if you have really small red blood cells and your hemoglobin is going down, that's something needs to be investigated. Someone wrote, I drink a lot of water and it just makes my urine clearer, which is
Yeah, I saw that.
that is
That's where you want to be, isn't it?
that's what you want to be.
Yeah.
If you have sickle cell disease and your urine isn't clear, you're not drinking enough water.
Yeah, your goals, hashtag goals. Um, what are your thoughts on the biomarker PIGF being an indicator of preeclampsia in women with sickle cell disease?
I'm not sure what that is since I don't take care of, I'm not an
Okay.
OBGYN, so I'm not sure what that means.
You spoke a little bit about this, but somebody asked, what are your thoughts on the pneumonia vaccine for SS patients?
So the pneumococcal vaccine really made has well, everybody who has sickle cell disease, especially children, should get the pneumococcal vaccine. Pneumococcal, that bacteria, back in the day, you know, before I was taking care of people with sickle cell disease, before they knew about penicillin, and in developing countries like in Africa, children frequently never reach the age of 5 or 10 because of pneumococcal sepsis or some other, usually that's the reason, but it could be some other kind of bacterial sepsis. So in this country, the, there was a dramatic change when people started giving young children, infants, uh, penicillin to try to modify the changes to modify their risk of infection to pneumococcus. And so people with sickle cell disease would take it until they were 5 years old, or maybe even older, depending on who was taking care of you. So um, the vaccine doesn't doesn't mean if you have a baby, it doesn't mean you get the vaccine and you could stop taking penicillin. That would be up to you and your doctor. Um, but the vaccine is very protective. I've taken the pneumococcal vaccine because people, when you get to be older, then you're more susceptible if you did get it to having a severe disease. So um, a lot of people without sickle cell disease get the pneumococcal vaccine.
Is it every year?
Is it what?
Every year?
No.
No.
It's
Oh,
like it's a one-time thing.
oh, okay. All right. The next question I have here is somebody says, I have sickle cell disease and my legs often turn colors due to poor circulation. They turn purple.
Uh, well, that's something, it's that you should be talking to your sickle cell provider about. But it's indicative of decreased circulation. So like if you're in the cold, you, your blood vessels contract, they get smaller um, on the periphery, and so you might notice that. But and something like that is hard to determine. It's not normal, and it's hard to figure out what could be causing that. So it would be something you'd need to talk to your provider about.
Is it turning purple due to the bruises? Is that typically what happens?
Well, it
Bruising?
could be bruising, it could be decreased circulation. If it's something that's there all the time, then it can be, it's due to um, some kind of tissue damage that causes bruising. So like I'm older, so what I've noticed is I get bruising a lot, and it's because um, my vessels and skin are just more friable. So that's if you have sickle cell disease, that's something that needs to be looked at because usually skin ulcers don't start exactly like that, but that's something to think about. If you have bruising, especially if they open, then you may be having you could develop issues with skin ulcers, which for sickle cell disease are pretty serious. She says, I think this is the same person, not bruising. So um,
Okay.
that's, but that's still something you need to talk to your doctor about. Why am I getting, why am is my skin getting dusky? Maybe there's something going on with your circulation. If there's any pain involved or anything, that makes it even more likely that there's a real medical problem that needs to be looked at. And she says it looks like, I think it's a girl, it looks like staining. Well, if you have bleeding into your tissues, it stays there. Usually it's purple, yellow, then it clears up. So that's bruising. So it needs to be looked at.
Okay. Can sickle cell trait affect menstrual cycles?
I don't think so. I don't think sickle cell trait should affect your cycles at all.
Okay.
But
Any,
but again, even though you have sickle cell disease or sickle cell trait, you can't blame everything that happens to you on sickle cell disease or sickle cell trait. So if you're having dysmenorrhea, you're having really a lot of pain with your period, or they're really spaced out and they're completely impossible to tell when you're going to have your period, and maybe you skip periods or whatever like that. That's something you need to talk to your physician about, your OBGYN, because you could have something else going on that has nothing to do with sickle cell disease.
the next question I have is any advice on how to prevent avascular necrosis? I have AVN on multiple joints because of sickle cell. So,
Uh,
thinking about prevention.
Yeah, I'm thinking. I'm trying to, you know, I'm not sure there's any particular way to pre that you could be proactive and prevent AVN. Um, you know, it's it's not clear why some people get AVN and other people don't. At least it isn't to me. I mean, I know how it evolves and what causes it, but I don't know why one person has AVN and another person with exactly the same diagnosis doesn't have AVN. It depends on your hemoglobin level, what your hemoglobin level is most of the time, whether or not you have other issues with your sickle cell disease, but I don't know that there's a way to prevent AVN. There's there was an article that was written years ago showing that you could decrease the pain of AVN with physical therapy. It did not, it didn't really stop the progression of AVN, but it stopped the pain. So I've never read an article where they show that physical therapy can prevent avascular necrosis, like someone's in physical therapy before they have AVN and then it prevented. It'd be really hard to do a study because you're going to have people that in your study that were never going to get AVN anyway. And it's a multifactorial thing. I don't think anybody knows exactly why one person gets AV and somebody else doesn't. At least I don't. Somebody else might know.
So if it's coming, it's coming.
Hmm?
If it's coming, it's coming.
Yeah. That you hate to say that it's like your fate
I
is
guess I
that
can
thing.
say it because
Yeah,
I've had
right.
it. So
Right. And the other thing is why do some people just get it in one joint and don't have it in another joint?
and
Why would
yeah.
you get AVN on one hip and no AVN on the other hip? So, there's things going on that aren't obvious that lead to AVN.
All right. I have my next question is any info on the oh, actually I asked that one already. Um, this person said I am SC, and I don't know if that means SC disease or sickle cell. I'm assuming SC disease, and I have frequent pain crisis. Is there something wrong with me? So I'm assuming this person has SC disease
Yeah.
and has frequent pain
So if
crisis.
you have SC disease, again, sickle cell disease is multifactorial. So, like when we talk about siblings who have the same diagnosis and their presentation is completely different, it goes for SC disease as well. So, there are people who have SC disease who have pain and who have other problems with their sickle cell disease. There has been a recent article that showed that people with SC disease can actually benefit from hydroxyurea. So if you have a hematologist, I would ask them if they've heard about an article recently, and I don't have it at the top of my head, but um, about hydroxyurea and SC disease. If you want to write to Ask Sickle Cell 101, I'll send you a copy of the article. But it, if you're having problems with SC disease, it's possible that hydroxyurea could be helpful. And it's a little people who giving S people with SC disease hydroxyurea is different than giving people with SS hydroxyurea because your hemoglobin's higher, and so you don't expect the same kind of response hematologically that you would with somebody who has SS whose hemoglobin's lower, and that's just a much more research thing. So if you give someone SS hydroxyurea, you kind of know what to expect, but SC, you'd have to do a little literature research to see how that was going to work out. I
I
see this.
skipped your question. What was your question?
Which
I'm still making my way through.
she
But
has pain.
put your
She has
question back
pain with
again.
the pain with SC disease. That was the question.
The pain?
She has pain with SC disease. She wonders why she's having so much pain with SC disease, or he.
That's the question I just literally asked.
And then someone says, I feel like the extra hydration helps me, but I'm being told I'm overhydrated.
Okay, but girl, did you get the answer? Did you hear the answer to the question?
Which one?
He just answered it right now, Tia.
Oh, I don't see that.
She's okay. Let us know if you didn't get it. Okay, just oh, I was getting to that one. I have that highlighted right here. Let me go ahead and pin it. So, does marijuana help with sickle cell pain?
Uh, there was a study done at UCSF, and they um, had people that it was very well controlled. So you had a special kind of like uh, way to give cannabis to people with sickle cell disease who had a history of pain, and then they had to stay in the hospital for I think it was 2 weeks or longer because they didn't want them taking, doing stuff on the outside. So, and it showed that it really didn't help sickle cell pain. But I think it was, I'd have to look back at the study. It was a while ago.
I remember it,
Yeah, I think they couldn't take other medications. I'm not sure about that. But
so
anyway, it didn't seem to help. But
but
in what people told me when I was practicing was, yeah, it helped a lot. And I think if you're taking pain medicine and um, smoking, don't smoke marijuana. It's bad for your lungs. People with sickle cell disease have lung disease, so that's not a good idea. Um, but it seemed to help. And as long as it didn't, interfere with what the other things they were doing, I felt like if, even if it's a placebo effect, whatever, if you thought it was making you feel better and it helped your pain, then it was worth doing. Um, it probably relaxes you. It may be just that alone help you cope with your pain. I
I
mean,
remember that study said it helped with mood. So it helped
yeah,
with your mood towards the pain. So
yeah,
half of pain is actual pain, and then the other half is like how you
right.
feel about that pain,
That's
right?
right.
And
Yeah,
so it improved the mood, which helped, I guess, directly or indirectly manage or deal with the pain. I think that study said.
right.
Um, I think you would always say when you would talk about the study, it's a very small study. I think part of the conclusion or the discussion portion of this was a larger study was needed,
Yeah.
so that we could have a real, I guess, representation of that experience. But I do know a lot of people with sickle cell who do use marijuana or CBD or THC, and says that it helps them. It never really helped me. Um, I think it just like brought my attention to the pain more. So like yeah, I just noticed the pain more. So I guess to each their own.
Yeah.
But yeah, there's not like a ton of research surrounding, the marijuana use and sickle cell, unfortunately.
But I mean, like what Cassandra says, it's sort of it changes your mood and your perception. So for some people, it's probably very helpful because it takes your mind off of the pain. But for other people, like Cassandra, for instance, it might make you focus more on the pain, because it's all up here. Um, and so it's going to have different effects on different people, which probably makes it difficult to do a study because you're going to have, it's not something you can measure. You can't really measure um, what happens when somebody takes a drug like that.
Okay. So hopefully that answers your question. There are a couple studies out there. So if you're interested in like kind of just going through some of the studies, let us know and we can Dr. Q does like an amazing job, but I will help too.
Yeah.
And getting some of those sources to you. But yeah, the limitation to some of those studies is just such a small patient population, and these t things kind of have to be tested in a lot more people. So. I've never seen this question come in before. And something I've wondered but never asked you. Are the IVs at med spas recommended to help sickle cell? They
Or what?
usually offer hydration along with vitamins like B12, C, NADH plus, and electrolytes. So could I go to my local med spa?
I wouldn't do that, actually.
Why?
Well, I mean, it's like if you, well, the people who do that don't have, maybe they do. I don't know, but it doesn't seem like there's a medical person who's involved in that, trying to figure out, well, what should this person have vitamin B or this or
Mm,
that? Like vitamin B12 turns your urine yellow. So a lot of people say if you aren't vitamin B12 deficient, you're just it goes right through you. It's a
yeah,
water soluble vitamin. So
yeah.
so there are vitamins that are water soluble vitamins, and they really don't hurt you because they go right through your body. You
Like
can't,
vitamin C.
yeah. So but something like vitamin A gets stored in your fat, and it can actually cause serious problems if you took too much vitamin A. So,
Mm.
these spas, it sounds like, really hydration, you can drink water to get hydrated. And so in
Sometimes an
with
IV is just easier
and
though.
yeah, well, yeah, I guess if you don't want to drink and you just want to like watch television or something,
Yeah, just get the water
watch a
transported
movie while
into me.
you don't have to worry about going to the refrigerator to get some water.
Yeah.
But the other stuff, if they give you vitamins and whatever, I would kind of investigate that to find out what are they giving, how much, and do I really need it? I mean, if it's a water soluble vitamin, it's just going to go right through you and it's not going to do anything. Because if you're not vitamin B deficient, then then it's just going to go right through you. If you are deficient, your body will take out what it needs and throw away the rest. There are other things like iron and some other vitamins that don't go through you. Like if you have sickle cell disease and for some reason the person at the spa says, "Oh wow, you really look pale. You're kind of anemic. I think we'll throw some iron in there." Well, you might not be iron deficient because you have sickle cell and you have hemolysis.
Yeah.
And iron overload is really common in people who are on transfusions or taking iron for some reason with sickle cell or other uh, hemoglobinopathies.
Yeah. So I mean, I don't know too much about the industry in general, but I thought these were people who had to have some sort of medical background running these things, but it sounds like they aren't.
No, well, I mean, it must be somebody who knows how to start IVs pretty well, because
So
they wouldn't
they're a
have
bunch
too many
of
clients.
phlebotomists.
Yeah. I mean, the other thing is, if you have sickle cell disease, you got to protect those veins because someday you're
That's
really going to
true.
need a good
That's
vein.
true.
And if you
That's
go
true.
somewhere where it takes 3 IV sticks to get you going, or, oh, sorry, that one infiltrated, let's do it on the other side. That's not a good idea if you have sickle cell. Those veins are really precious. And so you don't want to have to do the external jugular the next time you go into the hospital because they can't find any veins.
Yeah, the asker said they are usually nurses, but try to upsell the expensive IVs.
Yeah.
So I guess because sickle cell needs to be handled with care and it needs to be handled with specialists and people who know what they're doing, it would be a no for the med spa. But I have thought about going to them. I'm not even gonna lie. There's so many near me. And, I just think about, oh, I was on a trip. Let me just go get, or before a trip, let me just make sure I'm hydrated and all that. But I never made it out there. But it sounds like I shouldn't either.
Yeah. I
Okay.
mean, it's I don't know. It's so weird. People they don't want to drink water. You want to get an IV. I mean, that's kind of weird.
Sometimes it's easier. Sometimes it's hard
Yeah.
for me to drink water.
I mean, I think people like who don't have sickle cell disease probably just like the attention. They go in there, people are really nice to them. They get an IV, they get hydrated, they're
We're
chit-chatting
attracted
with
to
the
the good
nurses.
care.
So maybe it's more like, you could go in there and not get the IV and then just feel better. They give you a big glass of lemonade or something and
Something
talk to
that
you.
hits the
And it's like,
spot.
oh, this is
Yeah.
kind of nice. Yeah, maybe, get a foot massage while you're there.
I mean, like you're actually painting the picture. Now I'm ready to head to one.
Yeah. But
But
for
yeah,
sickle,
I
but
understand. I
for sickle
understand.
cell, having people start IVs on you is probably not a good idea.
Yeah. Okay, there's a follow-up question. B12 is supposed to give you energy. That's correct, right?
The what's give
B12. And that's I take B12 for
um
energy.
it
It's like a
doesn't,
blood builder.
yeah, I mean, if you're, I don't think so. I mean, maybe I don't think so because if you're not B12 deficient, it just goes right through you. It doesn't do anything. And I think that if you were, you would have to be really severely B12 deficient to have symptoms, which used to happen because people had uh, some people have can't absorb B12, so they have a lot of issues. But I don't, I don't, I don't.
Oh, I take B12 for energy.
I mean,
And
I have to admit, I do take vitamins. I take fish oil, I take vitamin D, and I do take kind
Mm.
of a B vitamin, whatever. And so I always pee yellow.
Yeah, same.
But I mean, does it really help me? I don't know. I don't know. But I'm like everyone else. I feel like, well, here they are. I'll just take them. Although it did show that uh, I've read an article where um, the that there is a trying to think of it. I'm getting old, so my brain doesn't work very well. But
Same.
but taking fish oil and stuff can decrease inflammation.
Yeah. Okay.
Which just reminds me, um, a lot of people uh, she's smiling because she knows so much. A lot of people take turmeric for pain who have sickle cell disease. And there's been a flurry of articles, and I don't know if people are reading each other's stuff and so they're writing more articles, but there's been a flurry of articles that document that some people get liver disease and liver failure from taking turmeric. It doesn't really the what I've they're not they're taking like gram amounts of turmeric. I mean a lot. And it does cause problems. So with your liver, because your liver detoxifies everything. So if you're taking something that that your liver has to work on to detoxify, depending on how much you're taking, it is going to affect your liver function. So if you're a person who takes turmeric more than once a day or a couple times a week, if you're taking it every day, um, it's probably not a bad idea just to talk to your doctor about it and find out whether or not it's
Yeah.
affecting your liver because it's extremely, extremely rare. But of course, articles pick out the most weird, rare things to get published. And there have been people who have died from liver failure taking turmeric.
Wow.
So
Okay.
it's really unusual. You probably have to take a lot of it because I
Yeah.
don't recall they actually said how much these people were taking. And the other thing is everything is genetic. So maybe some people can't metabolize the material in turmeric
And turmeric.
that works on the inflammation. And if you can't, then that could really
Be
damage
an
your
issue.
liver.
Yeah.
So it doesn't happen. It's rare, but it does happen. So I don't think there's anything particularly wrong about taking turmeric. You just have to make sure that it's not affecting your liver and that you're not taking too much.
Yeah.
And so if you're taking turmeric, and if you know people who take it, I would just caution them that, that you can take too much. Just like every other drug, you can take too much, and it's a drug. The other thing with you don't really know what's if you're if unless it's those kinds of things aren't monitored by any FDA or any other government agency. So I've read that people sometimes put uh, um, material into the turmeric.
Sawdust.
What? Yeah,
Sawdust.
yeah. Well, or lead, because lead can make it look more orange. So there's no regulation, so you don't really know what you're taking. Although, if it's but and one of these, this is weird, but one of these articles was about someone who was buying it on Amazon. So Amazon sells all this stuff, and they were buying it on Amazon. I don't know how that got into the article, but they were buying it on Amazon, and that's how they got sick.
Yeah.
Anyway, that's my 2 cents on
All
turmeric.
right. I have one last question for us today. It's a big one, so I'm gonna leave you. And this person asked twice, so I'm gonna ch ask it, and then we'll wrap up. What are your thoughts on gene therapy for sickle cell?
If you qualify and you understand what the current gene therapy protocols are, then I think it's great. There's a lot of side effects because it's like a bone marrow transplant. So you do have to, it's a very, I wouldn't call it arduous, but it's a long journey. But at the end of the journey, you're cured of your sickle cell disease. You don't have sickle cell disease anymore. And there are two different approved types, so you need to know which type you're getting and what it's going to do. One increases fetal hemoglobin, which is to a level where you don't have any symptoms, and the other one actually changes your hemoglobin. It increases a particular type of hemoglobin. So you need to be very, very well informed and understand what it takes to have gene therapy. And then if you're willing to go along with the risks and the side effects, then it's literally life-changing. You don't have sickle cell disease anymore. So I think it's a, a step forward. And I think it's what they're doing now is kind of proof of the concept that you can actually change people's hemoglobin. So you can expect if in the next couple of decades, 5 or 10 years from now, there are going to be different ways to do it that are not as that are just not as toxic as getting like a bone marrow therapy, getting a bone marrow transplant kind of therapy in order to get gene therapy. I've even read that there are oral medications that can turn off the uh, modulator for fetal hemoglobin and increase your fetal hemoglobin just with an oral medication. So there's going to be some really big changes in the next 5 or 10 years. But right now, if you want gene therapy, then you really have to investigate it, figure out what the side effects are and all that kind of stuff.
Definitely a step in the right direction. It may not be for everybody right now just because of, the process is arduous. It really is. You have to, I think, dedicate a year maybe of your life. So it's a big decision. But yeah, there's some
And
people who don't
it's
want
it's
to.
very it's very expensive, and it's not something that everybody can get just because there are not that many centers that are approved to do it. So if you live in some state somewhere, you may not have any, it's not something like a bone marrow transplant where you can probably figure out where to get a bone marrow transplant near you, but to have gene therapy, I've read it's probably more now, but
I
when
think
it
they've
first,
expanded centers.
yeah, I mean, it sounds like they can't do more than a couple hundred people a year. in this country with gene therapy because, like as Cassandra's saying, it's really time intensive. It's kind of it takes special laboratories, a lot of it's a definitely a journey. Yeah,
Oh,
someone says I'm in Florida and it's 2 million. Yeah, that's the kind of going, that's what people say. It's $2 million for, although there was a evaluation that said that the $2 million price tag for the insurance companies is actually worth it. Because if you get gene therapy in your 20s and you're cured,
saves the money.
you save $2 million for the insurance company that would have to treat your sickle cell disease for another 20, 30, 40 years. So for the cost, it's actually cost effective. So it's expensive, but um, and it's going to change, but we'll
Yeah,
have
as
to.
of right now, there are different ways. I think I don't know. So there's a clinical trial which you can enroll in, or typically that's how people get around the cost of that. But also, last time I checked, and I don't know under this administration where that's at, but the HRSA and HHS were looking at models to cover gene therapy to make it a little bit more accessible. So you don't have that $2 million price tag. I don't like, again, I'm the wrong person to ask about this. I just know that there is efforts surrounding creating models for making gene therapy. Because to Dr. Q's point, sickle cell is costs a lot. It costs more than the $2 million over a lifetime. And so people are really seeing this as an opportunity to drive costs down. Everything's a business decision within, healthcare and everything. So, I mean, but if it's a win for us, right? So that's ultimately what I think state by state states are looking at adopting different models on how to cover costs for gene therapy so that it is accessible to people.
And it's a kind of therapy where the costs aren't going to come down. It's so technologically intense that they don't do enough to make, so the cost is going to stay the same for the future, near future. But like I said, there are other ways that people are working on to increase fetal hemoglobins to the same level that you might get in gene therapy in different, you know, people are very always optimistic about their particular way to do it, but uh, there's several uh, labs working on how to do that much easier than a. Oh,
All right. Well, we
okay.
are at time, guys. Dr. Q, you want to wrap us up with your statement?
Yes. So, this is, we're not, I am not advocating that you get any kind of therapy, gene therapy, hydroxyurea, whatever. I just feel like what Sickle Cell 101 does and what I try to do is give you information. Information is power. Which is why when we were just talking about gene therapy, I said the first thing you need to do is really inform yourself. So I see myself as informing you about things related to sickle cell disease. And it's my opinion. Other doctors may not agree. You might say, oh, yeah, Dr. Q said this on Sickle Cell 101, and they might disagree with me, which is, that's just the way things are. So I'm not giving you advice. I'm not telling you what the best treatments are for your sickle cell disease. Those kinds of things you have to ask your primary care provider. They don't know the most about you. They know your history. They know what's worked and what hasn't worked in the past. So um, this is just for information only, which is what Sickle Cell 101 is about. And I'm really happy that I have that lady up there, Cassandra.
Who, me?
Yes, because I couldn't, I don't have sickle cell. So, I mean, I'm just kind of like talking, but you can really add your personal experience and the experience of your friends that really makes this a really valuable thing for people with sickle cell disease and for people who take care of people with sickle cell disease.
Well, it's definitely a team effort here.
Yeah.
You are the
How
wealth
long
of
how
information.
long have we been doing this now?
Oh, I think next year will be 10 years that
Yeah.
we've been doing
Yeah.
Ask the Experts.
We used to sit in my kitchen and do this.
Yeah, we maybe next year we should take it back to your
Yeah,
kitchen.
take it back to my kitchen.
Yeah.
Oh boy. Well,
Well, thank
thank
you all
everybody
so
for
much.
watching and
Yeah,
thank you for joining us. It's really been fun.
the questions were great. Have a
Yes.
wonderful weekend. Make sure you are resting well, drink your water. Don't get overhydrated, but drink your water and mind your business. All right.
Yes. Take good care of yourself. We love you.
Love you guys. Hold on. Do the Gen Z heart there. All right. Bye, guys. All right. And then
That
let me
was
go
fun.
ahead and